Welcome to the Head and Neck Center. I'm your surgeon, Dr. John Caniglio. I'm an ear, nose, and throat, fellowship-trained head and neck surgeon serving the community for over 25 years. Our practice is affiliated with the University of Rochester, as well as Rochester Regional Health. This brief video will prepare you for your upcoming surgery. If you have further questions, please ask our physician assistant today, and of course, visit our website. You have been referred to the Head and Neck Center by your pediatrician or general practitioner due to chronic tonsillitis. The tonsils are tissue masses that sit beyond the tongue on both sides of the mouth. Adenoids are similar tissue masses that sit higher up behind the nose and roof of mouth. When functioning properly, the tonsils and adenoids help the body fight infection. Unfortunately, your tonsils and adenoids are harboring infections. This likely causes swelling and soreness, making it difficult to swallow, and perhaps also causes earaches and difficulty breathing. Once we remove your tonsils, your body will still have the ability to fight infections, and your incidence of sore throat and discomfort will be minimized. Today is your preoperative consult. We will check your heart and lungs and answer any remaining questions you may have and administer your prescriptions. The night before your surgery, stop eating and drinking before midnight. On the day of your surgery, you'll meet your anesthesiologist. Tonsil surgery typically takes less than an hour. When you wake up in the recovery room, you will have an IV in your arm. You will likely be groggy and may feel nauseous from the anesthesia. You may need an anti-nausea prescription after one day. After surgery, it will be difficult to swallow. It is okay to talk. You may have earaches, bad breath, have a swollen uvula, and sores on your tongue. Some patients experience a mild fever, and this is normal. If you notice heavy bleeding in your throat, please call the office. This typically happens 1 week after surgery. You should lay low after the first few days of surgery. It is critical that you drink plenty of fluids to keep yourself hydrated. To manage any pain you experience, take the pain medicine prescribed. If you find that the narcotic makes you nauseous or itchy, take Tylenol or generic acetaminophen instead. Do not take aspirin. Advil or generic ibuprofen can be substituted for patients who have sensitivity to narcotics. We typically use Tylenol or Advil exclusively for children under age 10. You will need to be on a diet of clear liquids like popsicles, Jell-O, water, and juice. Avoid hot beverages as they will irritate your throat. Slowly progress to more solid foods like mashed potatoes, bananas, oatmeal, ice cream, yogurt, mac and cheese, and scrambled eggs. You may notice a white coating in your throat, and this is normal. Many people begin to feel better 5 days after surgery, but then experience worse pain about 7 days after the operation. This is a part of the healing process. You may return to normal physical activity 10 to 14 days after your operation.
Dr. Caniglio, what do I need to do to prepare for surgery?
Well, for 1 week prior to surgery, avoid aspirin, ibuprofen, or any other medicines such as blood thinners. Tylenol or acetaminophen is always okay.
May I take my daily medication?
Continue to take your daily meds in the weeks leading up to surgery. Your anesthesiologist will instruct you into which medicines to take on the day of surgery. These medicines should be taken with just a sip of water. If you have any inhalers, make sure you take a dose the morning of surgery and bring the inhaler with you.
Is there anything else I need to do to prepare for surgery?
Go online to the Westfall Surgery Center or Rochester Ambulatory Surgery Center website to complete your medical history, if you have not already done so.
What time is my surgery?
The time of the surgery is set by the hospital or the surgical center. Our scheduler will give you a number to call the business day before surgery to find out what time you need to arrive.
What should I expect after the operation?
Your throat may be sore for up to 14 days. It is not uncommon to feel some ear pain. White or gray coating where the tonsils were removed is to be expected.
How long will I be in the recovery area?
Most patients stay in the recovery room for about 2 to 3 hours.
Do I need to arrange for transportation after the surgery?
Yes, you must arrange for transportation and have a responsible adult available for you the first night at home.
What prescription medications will I need to take?
You'll be provided with 2 prescriptions for use after your surgery. The first is an antibiotic to begin the day after surgery. The second is a prescription narcotic to be used for pain management. Pain medication can cause nausea or constipation, so always take it with food and use a laxative if necessary.
Are there any restrictions after the surgery?
You need to avoid acidic foods or acidic drinks. Room temperature beverages are always best.
Can I eat dairy products?
Yes, you may eat dairy products, though you may find that they cause your mouth to produce a little more phlegm. If you find this bothersome, rinse your mouth out with water after you eat, or you may try low-fat dairy products.
Can I use a straw?
Yes, it's not a problem.
When should I come in for a follow-up visit?
The surgery center will call you post-operative day 1, and we will call you post-operative day 7. If you're having any problems, we will schedule a follow-up visit.
How long will I be out of work?
Most adults are out of work for 14 days after this surgery. We ask that children stay home from school for 1 week after surgery and stay out of gym class for 2 weeks. We can provide a note for school or work if needed. Do you have any more questions?
No, I think you've covered everything.
Great. Make sure you review the written material provided a few more times prior to your surgery. Thank you for your attention, and thank you for choosing the Head and Neck Center. Our physician assistant will be in shortly to answer any further questions.